Have you ever pondered the terrifying scenario of waking up during surgery? Well, it's not just a figment of your imagination, it has really happened. Let's delve into the concept of anesthesia awareness. It's a term that sends shivers down the spine of anyone who's ever contemplated going under the knife. It's like a scene from a horror movie where you're trapped in your own body, unable to move or speak, while being acutely aware of what's happening around you. Sounds terrifying, doesn't it? However, it's crucial to note that it's a rare phenomenon, but it does occur. Now, before we get carried away by our fears, let's understand what anesthesia is. In the simplest terms, anesthesia is a state of controlled, temporary loss of sensation or awareness. It's used during surgeries to prevent discomfort and pain. Think of it as your body's "do not disturb" sign, letting doctors carry out their work while you're blissfully unaware. There are three main types of anesthesia: general, regional, and local. General anesthesia makes you completely unconscious and unable to feel pain during medical procedures. Regional anesthesia numbs a specific part of your body, like your lower half during childbirth. And then there's local anesthesia, which numbs a small specific area for minor procedures. Now, back to anesthesia awareness. This term refers to instances where a patient under general anesthesia becomes conscious during surgery and can recall the experience afterwards. Yes, it's as unsettling as it sounds. But let's put things into perspective. It's estimated that anesthesia awareness occurs in 1 to 2 out of every 1,000 cases. That's a minuscule percentage. Moreover, in most cases, patients don't experience pain but rather a vague awareness of their surroundings. It's like eavesdropping on a conversation while half asleep. However, in rare instances, patients have reported feeling pressure, hearing conversations, or even experiencing pain. As frightening as it may sound, anesthesia awareness is a real occurrence, but remember, it's quite rare. So, while it's normal to feel a bit anxious before a surgical procedure, rest assured that the chances of waking up mid-surgery are extremely low. Now, let us delve into some real-life stories of those who have experienced this chilling event. Our first tale takes us to the story of Jane Doe, a woman in her mid-40s who went in for a routine gallbladder surgery. As the anesthesia was administered, Jane drifted into unconsciousness, trusting in the expertise of her medical team. However, midway through the procedure, she found herself jolting back into a terrifying state of awareness. Jane was conscious, able to feel every incision and every movement, yet paralyzed, an unseen prisoner in her own body. The pain was unimaginable, akin to being set aflame from the inside. The worst part? She couldn't scream, couldn't move, couldn't alert the doctors to her agony. As the surgery progressed, Jane could do nothing but endure the pain, each second stretching into an eternity of torment. When she was finally able to communicate her ordeal, the doctors were horrified. They had been unaware of her consciousness, her pain, her silent screams. Jane's experience is a chilling illustration of the rare but real phenomenon known as anesthesia awareness. Moving on, we have the story of John Smith, who was scheduled for a knee replacement surgery. Unlike Jane's ordeal, John's experience was devoid of physical pain. John, too, slipped into unconsciousness with the administration of anesthesia. But as the surgery proceeded, he found himself in a state of semi-consciousness. He could hear everything around him, the beep of the monitors, the sterile clatter of surgical instruments, and the casual conversation of the surgical team. John lay there, a silent observer trapped within his immobilized body. He heard the doctors discussing their weekend plans, the latest sports scores, and even the complexities of his own surgery. It was a surreal experience, like being an invisible entity in a room full of oblivious people. Yet despite the strangeness of his situation, he felt no pain. When John finally shared his experience, it left his medical team baffled and deeply concerned. These experiences, as unsettling as they are, shed light on the reality of anesthesia awareness. They serve as stark reminders of the complexities of the human mind and the limits of our medical understanding, but most importantly, they underline the importance of communication and vigilance in ensuring the safety and comfort of patients under anesthesia. But how does this happen? What causes someone to wake up during surgery? Well, let's dive into the medical explanation of this phenomenon, known as anesthesia awareness. Anesthesia is a fine balance. It's a cocktail of drugs, carefully calibrated to keep you unconscious, pain-free, immobile, and to help you forget the procedure. But sometimes, despite the best efforts of the medical team, this balance can be disrupted, and you might find yourself aware to some degree during surgery. One of the most common causes of anesthesia awareness is the type of surgery you're undergoing. Certain procedures, like heart surgery or emergency surgeries, may require a lighter level of anesthesia. In these cases, the risk of anesthesia awareness increases as doctors must walk a tightrope between keeping you under and keeping you safe. Your personal medical conditions also play a crucial role. For instance, people with a history of substance use may have a higher tolerance to anesthesia. Others may have specific genetic factors that alter how their body metabolizes the drugs. Even your age and body weight can influence how you respond to anesthesia. Sometimes, the cause may be a simple error in administering the anesthesia. These could range from issues with the equipment, dosage errors, or even a misjudgment of how much anesthesia you need. This is rare, but it does happen. Finally, let's not forget the role of the anesthesiologist. They are the conductors of this complex orchestra, continuously monitoring your vital signs and adjusting the anesthesia levels accordingly. Their expertise and vigilance are key to preventing anesthesia awareness. So, you see, there's no single answer to why someone might wake up during surgery. It's a complex interplay of many factors: the type of surgery, your personal medical history, the anesthesiologist's skill, and sometimes plain old human error. There are multiple factors at play, and the cause can often be difficult to pinpoint. But remember, anesthesia awareness is extremely rare. So, if you're about to go under the knife, don't let this scare you. Your medical team is well equipped and highly trained to ensure your safety and comfort. Knowing this, you might be asking, how can we prevent this from happening? The good news is, there are several precautions that medical professionals take to prevent anesthesia awareness. First off, anesthesiologists follow a strict protocol for administering anesthesia, which involves careful monitoring of the patient's vital signs, including heart rate, blood pressure, and oxygen levels. This allows the anesthesiologist to adjust the dosage of anesthesia as needed, ensuring the patient remains unconscious throughout the procedure. In addition to this, advancements in monitoring techniques have made it possible to better gauge a patient's level of consciousness during surgery. For example, the use of electroencephalography, or EEG, enables anesthesiologists to monitor brain activity and adjust the level of anesthesia accordingly. This has been a game changer in reducing instances of anesthesia awareness. Another method employed is called balanced anesthesia. This technique uses a combination of drugs, each with a specific purpose: one to relieve pain, another to induce unconsciousness, and yet another to relax the muscles. This balanced approach helps to ensure that the patient remains unconscious and pain-free throughout the procedure. However, despite all these precautions, in the rare event that a patient does experience anesthesia awareness, there are coping mechanisms in place. Post-operative psychological support plays a crucial role here. Patients are encouraged to talk about their experiences, which can help them process the event and reduce the risk of long-term psychological distress. Cognitive behavioral therapy, a type of psychotherapy, has also proven effective in helping patients cope with the trauma associated with anesthesia awareness. To conclude, while the thought of waking up during surgery can be terrifying, it's important to remember that it is a very rare occurrence. The field of anesthesiology has come a long way and continues to evolve, with patient safety and comfort being of utmost priority. With continuous advancements in medicine, the risk of waking up during surgery is being actively minimized. So what should we take away from all this information? From the unthinkable awakening to the terrifying tales, we've delved deep into the unnerving idea of waking up during surgery. It's important to underline that this phenomenon, while deeply unsettling, is incredibly rare. The potential causes can range from the patient's individual characteristics, such as age or body weight, to the specifics of the surgical procedure or anesthesia used. However, medical professionals are highly trained to anticipate and manage these variables to minimize any risk. Preventive measures are also in place, such as monitoring systems and tailored anesthetic plans, ensuring patient safety and comfort. Furthermore, coping mechanisms for the unlikely event of intraoperative awareness are being researched and developed, providing a safety net for those rare instances. While the thought of waking up during surgery is indeed unsettling, remember that it's an extremely rare occurrence, and medical science is continuously working to make it even rarer.